For us in FCT, with the advent of COVID-19, even before it came into Nigeria, we made a lot of preparation to tackle the epidemics, because when it became so overwhelming for other countries, we were quite prepared because we were expecting it. Now it's a pandemic, Nigeria is involved. FCT, we have seen so many cases. Before then, we have our emergency operations center, which has been put in place before the advent of COVID-19, because I've been there for us to utilize. It's linked with the 6 area councils, so we operate at both state and area council level. We trained healthcare workers, not really on case management. We trained them to identify the signs and symptoms of COVID-19 and be able to make appropriate referral, and then know how to manage such cases. Before we had COVID-19, we've sensitized a lot of healthcare workers. We did a facility-based training for them on COVID-19, and we went to communities to sensitize people on COVID-19. A lot of communities were covered. Ever before, we picked the first case in Lagos, and then before it gets to FCT.
This community is called Otako. It's one of the outreaches we are doing as we speak. Our teams, we have about 3-4 teams in different communities, different locations. Basically, the idea is to actively identify, actively fast-track the taking of samples, and fast-track the diagnosis, as well as getting the result to triage those that have the illness. Before now, we have mapped up all the communities. Based on the cases we have analyzed the cases spread across the 6 area councils. And majorly all these cases, so far 50-something of them are in Amak, with only outliers to Buari. And even the Amak is mostly within the city center, like Maitama, Asokoro, and so on. And we look at the slums around this. For example, these cases, could they have domestic servants that could be residing within? Could they have possibility of interacting freely? They may be more at risk. So that is what informed the decision of the selection of this slum. Yeah.
What we do is to get into the community through the gatekeepers. We pay advocacy, we get the buy-in of the community leaders. But naturally, you know that some people will want you there, some people will not want you there. So we did that, but some communities are very unfriendly. But that will not deter us, right? So when we did this training, we found out that so many people want to be tested. Some communities, their awareness is still very low. The adherence to the stipulated guidelines or the stipulated preventive measure is still a challenge in the community.
The news is rampant. A lot of people have it here, so I have to come and do tests to know my status. Yes, and to be enlightened more about the coronavirus. The reason why I came to do the test is because I greet my neighbor, they greet me as well, and sometimes if anything got finished in the house, I go out to get some things in the house just for me to use, and I don't know who is contacted or not.
I heard about the coronavirus and I went and make my tests. Yes, they tested me through my mouth, my nose. Yes.
We have the cooperation of the youth and we have the cooperation of the chief, and that is why the work is going like this. But in some areas, they don't even allow us to come in. Like if I come to this area and I notice that the quantity or the number of people we're expecting, targeting, we're not getting them, I take the pain on my neck to go like from house to house and be educating them, telling them the reason why we're here, and telling them the danger of them not doing this test. And some of them, they accept, some they will tell you, no, they have made up their mind.
I'm a volunteer staff based on this COVID-19 pandemic. It is my wish and my passion to contribute to the well-being of my nation, Nigeria, to see that people are being tested in whatever that's going on in Nigeria. So I'm not just doing it because I want to gain something, I'm doing it because of passion, because that is actually what I love to do.
I believe that this COVID-19 has gone across the whole country. So every state should sit up and start searching. We call it active case search. You don't wait until it visits you before you come and start. We did that in FCT because we were waiting. Active case search, we were telling everybody this is the signs and symptoms. The first cases, that was how we were able to arrest it. You could remember that when we got our first cases, the first 3 cases, there was turbulence all over the place.
We listen to radio every day. We had the sensitizations. Even after you are a victim, it will be of help for you to know your status in order not to spread it to another household or a family. Where I worship, even before now, we were being told that if government make a program on ground to check status, we should go, and then we should avoid gathering.
The main challenge that we are having is the communities being friendly. Because with lockdown of 1 month, people are getting aggressive and getting agitated for food. The only thing they say, palliative, if you are coming to our community, you are not bringing food, then we will not let you in. So the security of the healthcare workers is an issue in those communities. And all the time we are being attacked, verbal attack, physical attack, but it takes us time to really calm them down.
Some of us, we have to leave our vehicle, we start running for our life. They started stoning, sending us, chasing us out of the community. We have to run for our life and go out. We are doing all we can to see that we attend to everybody that is ready to come for this sampling.
We appreciate the efforts federal government really puts in place in curbing and sensitizing people as regards to this epidemic disease.
Despite the fact that we have our challenges, we have really done a lot in FCT to make sure that the COVID-19 is being tackled. Ever before we start having cases, we were prepared. There is no system that has it all. They say it's perfect. But at least to some extent, we were really prepared. We didn't miss many cases, and our cases are being managed properly.